Great. All right, so welcome everybody to today's ICCP ECHO session. We are very excited that this is our 6-month mark, our halfway through the year mark of the ICCP ECHO for National Cancer Control Plan implementation, and we're very excited to hear from our country teams and appreciate the work you've done in advance of today's session in sharing your slides and updates on the progress you've made on those priority areas within your National Cancer Control Plan that you had prioritized to work on in this 6 to 12 month period. So before we start, just a few logistics. We are, as always, ask that you mute your microphone unless you're speaking. Use the chat, please, to introduce yourself and post questions and comments throughout the session. And as Karen said, if you are able and the bandwidth allows, please turn your video on so we can have an interactive session today. And speaking of interactive, in addition to the 5-minute presentations that we will have from each country team, we're also going to utilize the Mentimeter online polling website to create some interactive questions for you all to answer around your National Cancer Control Plan process. So please feel free to participate in that. We want your active participation. And also, I would like to note that each of the countries who have submitted their project slides have posed pretty substantial challenges that they're going through in the implementation of their plans. And this will be an opportunity for everyone here to weigh in and share feedback and share perhaps lessons learned already on the ground in your country that you can share with your colleagues from other countries that are sharing their progress and update. So as mentioned, each of the presentations will be 5 minutes in length. Leslie and Karen will lead us through that process. We've created a centralized slide deck for those countries that had the opportunity to share their slides with us. And we understand, of course, we are still in the middle of a pandemic. We understand that many of the countries are having challenges with their work being prioritized towards the pandemic response. So please understand if your colleagues were not able to share information. There are a lot of circumstances going on at the same time. So, but we do welcome to hear from those who were not able to share slides, even share verbal updates when it gets to your turn to share. So without further ado, I'll turn it over to Karen and Leslie to walk us through the agenda. And just to also note, as I mentioned, we will be using Mentimeter, and it's pretty self-explanatory, but as questions pop up on the screen, you will see a website there that you can go to either on your phone if you have that capability, or on a laptop or computer if you're at one, and type in the website, and there's a code associated, and it automatically pops to the questions that will show up on the screen here. So I hope that that's pretty self-explanatory, and if not, please reach out with questions in the chat. And over to you, Karen and Leslie.
All right, thank you so much, Mishka, and thank you for everybody being on the call today. Welcome, we're happy to see you. So not much more to tell you about the agenda, except for we are going to have these questions kind of interspersed. It's just an opportunity in a little bit of a different way than a poll that you might be used to on Zoom. It's an opportunity to hear from each other, to interact and kind of present the results in a little bit of a different way. So the first question or two you'll get the hang of it. It's really quite easy, but you do need to go on to either have another window open on your computer, or if you're on a phone, you'll have to jump to another screen, I believe, if you're on your phone. Really, the questions revolve around what we're asking everyone to present on today. So not only will we be asking you to present regarding the priority that you chose, but we want to hear about facilitators and barriers to actually making progress on those priorities. So I think Mishka did a great job of explaining. We want folks that sent in slides to go through those, and then we'll have an opportunity to hear from other countries. And then hopefully we'll have some time to just discuss and maybe do some problem solving. So with that, let's start with the first Mentimeter question. And Doug is going to share this on the screen. So if you see at the very top here, the go to www.menti.com, you can see and use this code. You can do that manually, or in the chat, I do believe Mishka just put the link in, and you can just click that and it will go right to the poll in a different window on your computer. So, and then all you do is we want you to rank these facilitators that we've pre-populated for you. Awesome, I can see people doing that already. So you select an option for your very first one you think that is the biggest facilitator, what's helping you make progress, and then go through the rest of them and rank in rank order the following ones. So we'll just give it a minute here. Hopefully this is making sense and you're able to, again, you can just click on that link in the chat, or at the top of this slide that's on the screen, you can go into menti.com and use that code.
Yeah, Karen, I see we have 4 people who've answered so far, so that's good. So if anybody has any questions about what to do, certainly just come off mute and ask.
As you can see, it's a little more interactive, these types of questions, than just the poll that Zoom offers. And it's, if you haven't used Menti before, it's really interesting at the number of different things that you can do with it. All right, so we have 6 folks that have gone on. Right now, what has helped you, you're saying kind of the #1 vote right now is political will and government support. Clearly something that we talk about a lot and how important that is. And obviously on the flip side, that same thing can be very much a barrier sometimes if you don't have that. So you know that we've talked about, you know, different ways to get political support, make sure that the Ministry of Health is very involved in your efforts. Policy implementation expertise is a close second, I see. Again, we're going to be talking more about that in the months to come, and really how policy is built into all of our all of your priorities. Partner support and engagement. That's a facilitator. That's awesome. And data systems in place, and clinical patient community support engagement. All right.
So Karen, I wanted to mention while people are still answering that we did not put in financing or resources, dollars as an option because we knew everyone would choose that. So we left that out of this question.
Yes, thank you. We left them out of next question too, because that's a big barrier. And so, as Leslie said, okay, well, we have 14 folks. It looks like the rank is still kind of how it was a few minutes ago. All right, well, we're going to come back to this when we talk about these in a little bit more detail. But so we want to just make note of #1 was the political will. 2 is policy implementation. And 3 is partner support. Okay, wonderful. Thank you very much, everyone. So now we're going to flip this a little bit. We're going to ask a similar question with similar answers, but now we want to hear from you all about barriers. What's impeding your progress? What's along these, again, same lines? What's been the most difficult for you as you try to implement your priorities?
So if you have your link still open, this question should have popped up for you and you can start ranking now.
Yeah, and on my slide, since I did have it open, it says go to next slide at the top of your screen. So Again, if you're looking at the old question, just go to next slide and you'll see the new question and be able to vote.
So we'll give it just a few more minutes for some of you to answer. But not surprising, the flip side of the facilitator. Here we have lack of political will, government support. Systems in place is so far second. Lack of coordination across disease systems is third. Lack of implementation expertise is fourth, and lack of patient community clinician engagement is fifth so far. Give it just another minute. Thank you, Doug. We can see how long everybody has to vote. So get your ranking in if you haven't done it yet. And we're going to come back to these also later after we finish the presentations and maybe see what kind of solutions we found that would be helpful as well. And thank you all for doing this. It's really helpful to us as well. Okay, so we're getting close and lots of people have answered. Thank you. So it comes out in the way that it was listed before. So lack of political will engagement is something that gets in the way. Lack of systems in place, lack of coordination across diseases, lack of implementation expertise, and then lack of patient community clinician engagement was fifth. Okay, great. Thank you so much, Doug.
All right, well, thanks everyone. Hopefully that's kind of a different way to gather your input and that was okay with you and enjoyable. We are going to launch now into the country presentations. We are going alphabetical and we, as Mishka mentioned, we received 5 countries slides and totally understand challenges that other countries had with getting those in. So please know we'll give you the opportunity to speak after these presentations of the 5 countries. We do have those on a master slide, so you don't need to share your screen. If you can just say next slide when you're ready to go to the next slide. We are going to be pretty tight about this 5 minutes. So if we hopefully don't have to interrupt you, we may start going like this when there's about 30 seconds done or left. But we want to make sure that everybody has a chance to talk and that we do have some discussion time. So starting with, and just to remind everybody, what we asked is what's the priority that you have been working on? What's progress have you made? What challenges have you had working on that priority? And then what would be helpful for you to move forward on that priority? What possible technical assistance or expertise would you need to move forward? So we were anxious in hearing about that as well. Okay, so Cameroon, you are up first. We'll bring up your slides. And who's speaking for Cameroon?
Hi, everyone.
Becca? Wonderful. Please go ahead. Your 5 minutes has started.
Thank you so much, Karen. I will be speaking on behalf of me.
Tata, you know what? You froze up. I wonder if you want to take your video off. Did she freeze up for other people or is that just me?
On prevention. I don't know if we can we all hear me?
We can hear you, but you know what, you froze. So I wonder if just while you're presenting, if you want to take your video off or shut down your video. because sometimes that helps and makes you not freeze so much. Perfect. Okay, go ahead.
So like I was saying, Dr. Sonna is not feeling okay, so I'll be taking his place. He was supposed to be doing this presentation. I'll just summarize what we discussed as a team, what we have been focusing on lately for 6 months. So our priorities were prevention and palliative care, and so far we have been able to advocate for the Ministry of Health to take that into serious consideration. And so an action plan was put in place to take charge of primary, secondary prevention. And so far so good. This April, there will be a pilot project that will be going on as a result of that. And also 20 health personnel from 4 hospitals have been trained on a cervical cancer screening program to go ahead with this pilot project. Thank you for the slide. So for the advocacy that we have been doing to get the Ministry of Health involved and focusing more on prevention, this has been so much in progress. And recently we have had a collaboration with the ICCCP, and data has been extracted from the DHIS and CBC to be used as baseline for cervical cancer screening in a program in Cameroon, though it's still pending some validation. And also, within the last 6 months, there had been a workshop with St. Jude Global in March 2021, and some recommendations for pediatric cancers, and some proposed objectives and collaborators to assist in the implementation was identified. And recently, we received funding from UNFPA that will be used this April for sensitization and screening program. Equally, some personnel from 3 district hospitals in the littoral region of Cameroon will be trained probably on palliative care. Next slide, please, if possible. So going to the difficulties or the challenges, like many people resonate with Cameroon, difficulties to implement this priority intervention. We have limited resources, as many other people can resonate. And still till date, the National Cancer Control Committee is still not well structured. So proper coordination of cancer control activity here is the issue. And we are always having challenges to know who is doing what, where, at what time. Most of the decision makers in cancer control are clinicians, and so most often they speak on treatment rather than prevention. And the tools that can help us and expertise needed, we need more public health experts in cancer control, health personnel of first and second category, and also get community relay agents and members of NGOs and associations to join in this priority for screening and treatment of precancerous lesions. I think we go to the next slide, please.
I think that was it. You just had 2 slides for you.
I just did a brief summary for what has been going on for the last 6 months. And I think we have been more engaged at our level of individual organizations to make sure that we join the National Cancer Control Plan for the implementation. Thank you so much.
Thank you so much. Very good job of really explaining very clearly what you have done, which has been quite a bit. And then clearly some of the challenges that you're up against. We really appreciate that. And we appreciate you sticking to that 5-minute slot. Again, as we go through all of these, we'll then come back and we'll talk about different countries and have some questions and answer time. So again, thank you so much, very much. Okay, next on the list is Eswatini. And who will be speaking for Eswatini?
Good morning, good afternoon, morning to the overseas, afternoon
Hello.
to the sub-Saharan region. Yes, how are you? I'm
Good.
Kolsile Lamin. Yes, yeah, good to be part of the meeting. And I think I'm ready to present our slide.
Yes.
Yeah. Okay, no, thank you so much. I think our priority was mainly on the capacity building on the comprehensive cancer care or the cancer journey. I think from our strategic plan, we could there are some few objectives that touch base with the capacity building training. So we as a country, we're fortunate to have an invitation from the African Access Initiative virtual training, where we have seen about 10 of our nurses who did the training for 5 weeks. They're about to graduate next week. So it was mainly on the oncology aspect or services within the cancers. And then secondly, which is can you, I think I'm missing some bullets below on my side.
We see progress
Okay,
so
yes, thank
far.
you. Now I can see clear. Yes, okay, then the second one was to strengthen the risk factors. As a country, we are fortunate that we have been supported by WHO to have our tobacco program, as tobacco is one of the risk factors that affects the population in terms of lung cancers, and probably it might lead to poor diet to some of the people. So now we have the program on the tobacco, and then we have a focal person that have been hired to ensure that we well establish this program for the year, and then later on it would be integrated to the services that are ongoing. And then on my side, I've shown some facilities that we do the cervical cancer screening and breast cancer. We did an assessment early last year. So we've seen that some of the facilities, they do the cervical cancer screening, although some they're not. So for those who are not doing the program, we've plan to do some capacity building of the nurses who are working on those facilities, and also ensuring that we support them with the equipment, or of course with the work of or the support from the partners. So some of the facilities already have been supported with the screening equipment to initiate the cervical cancer screening. So it's two-way. The support is the training capacity building for those nurses, and also the capacity in terms of procurement of the equipment. And then just today were the last day for our matrons. Matrons, I think you all know, they had the nurses in different facilities. So we did that just for the capacity, sort of a sensitization for the nurses. And then at the same time, we were fortunate to get the focal persons for all the regional hospitals, because our program is a national. Then we have 4 regions. So in each region, we have a cancer coordinator who will be helping us to ensure that the services that are expected in terms of cancer prevention, diagnosis and treatment are there. So we have our regional officers who are nurses, and also the focal persons who are working now in the different regional hospitals and also the health centers. So tomorrow and the other day we'll having a training for those focal persons and regional coordinators. So what is happening now, I think I once shared with Leslie or Karen that our main aim is to ensure that this issue of the cancer services that are being designated, or all the facilities down there that they do the cancer services. So this is how we're growing as a program. As much as we are 4 or 5 in the office, but we're growing through the focal persons to ensure that we have nurses who are doing the services. And also the country, we're fortunate to collaborate with Roche. They are going to give us the immunohistochemistry machine to ensure that we strengthen our diagnosis and treatment in terms of the cancers. So now we've seen a good turnaround of the pathology results. I think some years we've been talking of our results in the laboratory. They take about 6 to 12 months without getting the results. As a result, we find that our patients are being diagnosed very late. But through the support, we got the pathologist who's working with the team in the laboratory. Now we're seeing a good turnaround. Instead of taking the 6-12 months to have the results, now it's taking about 2 weeks or a week to get the results, which is really a huge success that we have as a country. Next slide, please.
We have about 1 more minute for you to wrap up.
Of challenges and needs. Okay, we still have a challenge in terms of getting people or officers trained in terms of the scholarship, but we're still working on that one. Human resource, we are working on ensuring that we have some officers who are trained, both the nurses and the doctors on the cancer issues. Then we still have the needs in terms of equipment and funding for the fellowship, since we want to ensure that every nurse is exposed to the issue of the oncologists, although that we know that not all of them are interested to do that. And also working to it's a need in terms of ECHO programs. We're working with other countries, South Africa and Kenya, to ensure that we implement these ECHO programs within the country. Thank you.
Thank you so much. Very nice
Next slide,
summary.
okay.
We appreciate that. Very nice summary. All right, next I think we have Rupa from India. Thank you. I don't know, Rupa, I'm assuming you're presenting, maybe someone else is.
No, I am presenting.
Okay, great.
Yeah, good evening, everyone. At the outset, I have to confess that we didn't do enough progress as much as we thought we would do or we had planned to do in 6 months. However, we'll just run you through whatever little progress we think we made. So at the start of ICCP, we had broadly categorized our priority areas under screening and prevention, cancer control continuum, and national cancer prevention research. So although the third point, the research, we did not do much. The first 2 priority areas, that is screening and prevention, that is to sustain ongoing efforts in capacity building. So NICPR is involved in capacity building through ECHO platform. We are training all the healthcare providers across the country. So that is ongoing, and that did not have any hindrance due to the present pandemic, since it's online and it's still ongoing. So taking this forward, our team summarized all the activities in this area done at NICPR ECHO program, which culminated in a manuscript, which we have communicated to global implementation research and applications. So in addition to this, we also, under the capacity building, so working towards the WHO's goal of cervical cancer elimination, WHO India office in collaboration with IARC is training 50 master trainer gynecologists across the country under the ICCP certificate program. So again, that is an online program followed by OSCE. So we have completed from our institute, Dr. Kavita and myself, we have completed the online ICCP. However, the OSCE, because of the pandemic, that is now postponed to the after maybe the dates are not finalized. And coming to the second priority area, which is cancer control continuum. So this is a major problem which we figured out at the beginning of ICCP itself, that is the gap which exists between the screening and the treatment. So screening takes place, but the evaluation and the treatment aspect, because of lack of diagnostic facilities and also the treatment centers. So that is a major gap. And to guide our learning and help us transform it into these actionable steps. So before the ICCP sessions began, we envisioned the creation of an expert advisory board with experts on cancer treatment, palliative care, and basic sciences, which are the pillars of cancer prevention and control. So we came up with this expert advisory group from National Cancer Grid, which is more than 400 centers across the country, which specializes in cancer treatment, prevention, and palliative care, basic sciences. So which completes this continuum. So they agreed, the experts agreed to provide input suggestions on identifying and selecting strategies for implementing the national operational framework, and also to help create opportunities to promote these activities and also research. So we have had a couple of virtual meetings with the advisory board, and we update them on regular basis regarding the progress. Next slide, please. Yeah, challenges. I don't think our challenges are different from other countries, which is now our cancer control program had gained good momentum last 2 years. And in March 2020, all the screening activities across the country, they have come to a standstill due to this pandemic. And all the health force are diverted to the COVID treatment, and the major treatment centers, tertiary centers like Tata Memorial Hospital in Mumbai and the All India Institute in New Delhi, most of the tertiary centers are now converted to COVID hospital. Even the cancer treatment is, come to a standstill. Forget about the screening part. So this is the major challenge which we are facing in this present pandemic. So coming to the last bit, the expertise needed. Yes, we would need suggestions to engage country experts. We know that networking is your strong forte, and then we would require partnerships that can evaluate implementation from the national perspective. And also the funding resources for research in cancer prevention is very less. When it comes to treatment, yes, we have a lot of funders, but when it is prevention, screening, early detection, we do not have, it's handful of funders, and that's very competitive. So if you can connect us to the funding resources to conduct research in this area. Thank you so much.
Thank you, Rupa. Really appreciate, very nice summary of where you guys are and where you're headed. Appreciate that. Let's see, we are on to Nigeria, and Paulette, will you be presenting or someone else?
Hi, good morning, good afternoon. Yes, I will be presenting. We hoped that Dr. Uche would, but he appears to be on the field, so I'll be presenting for Nigeria.
No problem. Your 5 minutes starts now.
Great. So we identified 4 priority areas at a focus group session. One was hospice and palliative care. The other, very much similar to other countries, was prevention and treatment. We then also highlighted cancer registry and data management and governance and financing. So we have made a lot of progress in prevention and treatment, but for the purpose of this call, we decided to focus on, for this presentation, we decided to focus on an area that really has been driven by the FMOH's, the Ministry of Health commitment to augmenting services that are already in place, which is the chemotherapy safety policy. And so for ours, we worked with the Ministry of Health, primarily Ministry of Health led the process of developing a draft we linked them, linked the Ministry of Health to the American Cancer Society, who has agreed to support with, sourcing for funding once this policy is done. So fortunately that, again, motivated a lot of commitment, and several people worked together to develop an initial draft. I will speak to the challenge more critically, but one of the challenges with having a final draft was lack of commitment from key players that we needed to commit, so that down the road when the policy is developed, there would not be a challenge with buy-in. And so the progress so far is that a final draft of the policy emerged after review by government, oncology providers, NGO players, industry players, patient groups at the International Cancer Week held in October 2020. This finalized version had to go through a couple more tweaks, but now it's on the Honorable Minister of Health's desk waiting for approval. Next slide, please. So pretty much like all other policies, if you do not have stakeholder buy-in at the point of developing, when the policy is launched, you have folks saying, well, you didn't capture what is important to us, you didn't capture what is valuable to us. So this was a major challenge. At one point, the policy was sent out via email to several people, and all we heard was crickets. So at that point, it became apparent that we needed to find a forum where people would be in person, or find another mechanism to get folks to look at it. So fortunately, the Ministry of Health and other players stood behind resuscitating the International Cancer Week, which originally happened yearly, but for a few years now has not happened. And so fortunately, with support from different partners, including industry players, we were able to put that together. And as a matter of fact, it turned out to be really valuable. I sat in on this policy review session, and there was a lot of feedback. Oh, this is what happens, this doesn't. And at the end of the day, everyone there who was, a major player by several ramifications were quite happy with the final product. And so then the next thing is government approval, right? So it's been on the minister's desk for a while now. We're following up, and we're hoping that sooner than later, especially now that we've made additional progress by engaging ACS to flag the need for an assessment to determine what is currently on ground at the centers before you even start to implement a chemotherapy safety policy, program, right? Because right now, we've made progress with improving access to anti-cancer medicines through the CAP program. So this, again, that's the reason why this policy was really critical, because sometimes when you go to the centers, the same sink where a patient might brush their teeth is where, leftover chemo would be poured down. And for most of us who understand how toxic these medicines are, that's definitely not safe. And so the other challenge is certainly a funding gap, which we're trying to close, because without the initial assessment, it would be really difficult to even say, where do we go from here with each of the centers? Yes, the policy is very broad, but at the point of implementation, there's a need to get a sense of what can we do now in the interim, even before we get additional funding for biosafety cabinets or redoing an entire section. And so finally, the tools and expertise we really need is capacity building at several layers, right? So capacity building, even for those at the ministry level who need to be engaging to raise funds, capacity building for HCPs at the point where the policy then becomes approved and we start to move forward towards implementation, especially because, unfortunately, when you're trying to disrupt an existing mechanism, you get folks who are a bit resistant to it. We've been doing this way. What do you mean we have to change this now? And just doing that initial advocacy and training to HCPs. So really, we wanted to focus on this particular priority. Again, we've made progress with a few other ones through support from the UNITAID funded secondary prevention grant, a number of healthcare workers have been trained across 3 states and even at the national level to do screening for it. And so, we've also expanded treatments through the CAP to additional centers, but this was really critical to flag because it's something that we hadn't done anything about prior to joining NCCP in October. And I think that having that focus group discussion was really helpful for us to say, okay, all right, these other priorities, we have some traction. Let's find something else that's really critical that we can put traction on. So thank you.
Oh, thank you, Paulette. What a great example of identifying a policy and the trials and tribulations that it takes to get it through it. Excellent. Thank you for sharing that. Okay, our last set of slides is for Tanzania. Who will be presenting for Tanzania?
I will be presenting. I'm Dr. Mamsa Ngoma.
Okay, your
And-
5 minutes starts now. Next slide.
Okay. Yeah, so our priority is more on the expansion of the population-based cancer registry coverage. And so to emphasize on that, it is more about the coverage. There has been some deliberate efforts by the government and also other institutes to develop the population-based cancer registry. And currently, in all the institutes that provide cancer services, they do have hospital-based registry, and they do have a model of reporting for the population-based cancer registry. But our priority areas in this part is mostly in training, because we feel like even though there are efforts, but still the cancer registrars, there is still a lot of mistakes. And so there's a high need for training, and also the protocols. In order for it to be standardized, we are currently all using CANRED, but still we need protocols in place in all the centers that are giving cancer services to have the same kind of procedures. Another is about assessment and mobilization of resources needed to improve data collection. In every area, we have to decide what we already have and what are the gaps so that we can work on that. So when we are talking about the progress national-wise there has been a lot of progress. There has been big institutes like IRAC that has been assisting us in the development of the population-based cancer registry, and these have been associating also public together with private practice, and also there has been a move to try to also organize even when it comes to those who die at home, the death certificate. And so in general, there has been a lot of progress, but the one that I'll be concentrating on here for this presentation is more about what we were able to do as a group, is to sit down and analyze on what we have and what we are missing, because all of us in our group are centered in different cancer centers in Tanzania. And so we were able to sit down and kind of discuss on what all of us have and what we are missing, so that we know our next step. We can go to the next slide. Like anything else, there are challenges and needs, and obviously we would be the first thing to say finances, but what we can emphasize on is that even though most of the cancer treating hospitals in Tanzania have attempted to develop this clinical database, it's not comprehensive. And many collecting, which are of little, as mentioned before, what is very important is training. Also, lack of proper monitoring and evaluation, which is obviously important for the assessing of the progress and enhancing effectiveness. There was a committee that was set up to kind of oversee a pilot that was done in Dar es Salaam and in KSMC, but all of these are more of efforts that are project-like, research-like, and so we need something that is more continuous, sustainable, a committee that will be in all the different institutes, all the different regions that have cancer centers that will be monitoring and evaluating the population-based cancer registry. And when we're talking about what we need, whether tools or expertise, we decided to look within ourselves in Tanzania. What we do need, we need ownership. We need strong leadership that will be able now to bring together the stakeholders, and that now will be all of you guys, other African countries, and even our collaborators to give us ideas and also other expertise and help. But we have to own it ourselves. And also we need to promote policies for cancer notification. As I said, that not all of them, not all of our cancer patients reach the institutions. And so there should be a strong policy about notification, even in the primary level hospital. And the government should also allocate funds for this. And that is when you can ask for other people to also help us, whether it be in a research setting or project, or even just funds. And also, we have to have dedicated committees, as mentioned before, in each region, and that will oversee these cancer registries, the population-based cancer registry, and they should be a common place that we can, all the centers can take their data, because at the moment it is the institute's property, it's the institute's responsibility, so there is no centralization, and that is very critical. And that is the end. Thank you.
Thank you, Dr. Mamsa. We appreciate it. So I think we'll take the slides down now, please. Thank you. And if anybody is able to turn on their video, that's great. We want to have a discussion now. We're going to go ahead and see if there are any questions that you all have of each other, country team to country team. And then also we have lots of our ICCP partners on the call today, and they may have questions as well. So first, any questions for anybody or any comments you want to make about the presentations that you've heard? Feel free to come off mute and just ask. All right, how about our ICCP partners? Any questions from you all?
This is Lewis Foxhall with MD Anderson. Just wanted to congratulate everyone on great presentations. Those were just well done and obviously reflect a lot of hard work and difficult work that you're all trying to get through to make some progress. So thank you for doing that and for your participation. Do you feel like, several of you mentioned areas of need or sort of the next steps, the barriers you want to get to through or around to make progress? Do you feel like you're getting feedback from us or from others as far as how to address those?
Thanks, Louis. That's a great question. Anybody, and maybe we can, we'll come back to that question, I think, Louis. Anybody else have any questions about the presentations? Because I think we'll come back around and ask that question for sure in many ways. Anybody have any questions for the presenters about what they presented specifically? Mishka, I noticed earlier you were going to come off mute.
Yes, thank you. And yes, thank you everyone for your presentations. I did notice it was very interesting to hear specific reference to partnerships you had developed at the country level that have been supportive of the progress that you have made. So if anyone has additional comments to make in terms of how, like, are there challenges around any of those partnerships, or other things you want to say about that aspect, but I guess that kind of goes a little bit to Louis's question as well.
Yeah, anybody have any, as that's true, a lot of people talked about building partnerships and getting that political will. So anything you want to say further about how you've made it work or what your continuing challenges are?
Leslie, can I?
Rupa, go ahead. Yes, please.
Yeah, as I mentioned in our presentation that we have built the National Cancer Grid, which is a consortium of more than 400 centers across the country. So we are in talks with them before ICCP started, and then we are also updating about what's happening and about our presentations and the progress too. But we actually do not know how to take it forward from here. So we have partners, they're willing, they have agreed to support us in whatever way we want. And now that we have a lot of challenges when it comes to screening and early detection, because the NCD program is totally come to a standstill. So that is a major problem what we are facing right now. We really don't know how to restart this program, which is now slowly dying.
Yeah. So anybody have any thoughts about that? We're all dealing with this. COVID-19 has put a stop to several different things. Have you been able to keep anything going, and how have you done that in this trying time?
Hi, this is Paulette. I just wanted to add that, what we were fortunate as an organization to be brought onto the table to discuss addressing the COVID pandemic. And so for every opportunity we got to also highlight how focusing myopically on just COVID could translate to we're done with COVID, and then we have a ton more other issues that already existed before. So I would say the first thing is to find those forums where COVID is being discussed and try to find that linkage between what can happen if we all focus on COVID and ignore all the other diseases that, at least in the Nigerian context, it was very apparent that, the existing diseases were already killing more people, right? And affecting more people than even COVID was. And so it was important to figure out a way not to ignore them. So that would that was what our major, what would I call it, win was, or major facilitator, I should say, to not having COVID completely derail us, so to speak. Over.
Yeah, well, thank you so much, Paulette. I think that's a great way to put it. And I know a lot of you have had success in that way, to be at that table, to talk about how to get a return to cancer prevention, early detection services in this time. And I think that's smart to be at those tables to talk about it. That's what we're also doing internationally as well with amongst this partnership. So I think, thank you so much again for your presentations and our discussion. I would like to see us take the questions on Basecamp, and would encourage everybody to do that. And I think now we want to move straight into our closing to talk about next steps. And I'm going to turn it over to you, Lindsay, to start us off.
Great, thank you. Thanks everyone. So my name is Lindsay Eldridge and I am from the U.S. National Cancer Institute Center for Global Health. And I think many of you know by now that I've been leading the evaluation of this ECHO. And so we started doing a post-session poll, but before we get to that, I do want to talk about the Midpoint Survey that's going to be shared in the chat, and also will be sent directly from my email following this session. So with this being the 7th session and now about halfway through the ICCP ECHO program, we are really interested in getting your feedback on how the sessions are going and how useful you're finding the information to be. So we'll also be asking about your interest in continuing the ICCP ECHO program for an additional 12 months starting in November. And knowing your plans and interests will really help us with planning future sessions. So again, the survey link will be shared in the chat. I think it was just shared by Luca, and I will be sending an email inviting you to fill out the survey. And we ask that you fill that survey out by May 5th. So now I do want to get into the poll based on today's session. So we really would like to know how likely you are to use the information that was presented today, and rating that from very likely to use the information to very unlikely to use the information. And we'd also like you to rate your overall satisfaction with today's session from highly satisfied with today's session to highly dissatisfied. Thank you.
Thanks, Lindsay. So everybody can see the questions that you have there. There are 2 questions. You might have to scroll down just a little bit to be able to answer both. So we'll keep that up as we do the rest of our closeout. And I want to say that Luca did put the link to Basecamp. If you haven't been on there for a while, today would be a great time, or tomorrow would be a great time to go. We'll be there too. We'll try to be there too and to help facilitate some discussion there. And so thank you for putting that up, Luca. The other thing is we will be talking about data again. We'll have our second discussion about data, and particularly about using data to help with monitoring and evaluation in our next session. So we'll look forward to sending you discussion questions in advance for that session, and a reminder to focus in on that topic for next time. So I think we're at the top of the hour. We'll leave this up for just a minute if you would like to complete the poll. But thank you all so much for joining today. And thank you so much for preparing those presentations. They were outstanding. We appreciate it. Thanks, everybody. If you finished the poll, you can leave. But if you haven't, please take it.
Really appreciate everyone presenting and being on the call today. Thanks so much.
Thank you.
Thank you. Bye.
Bye. We'll see you next month.
Okay, thank you.
Bye, Leslie.